And we begin this half hour with a warning for expecting parents. Thank you for staying with us. I'm Alan Campbell.
And I'm Glenda Lewis. A new study shows pregnant women not only have a higher risk of getting infected with COVID-19, but they may also face a higher mortality rate. Our chief health editor, Dr. Partha Nandi, joining us now this Monday afternoon. Good afternoon, Dr. Nandi.
Afternoon, Glenda. How are you?
Fine, thank you. So can you tell us how much higher the risks are for expectant mothers?
So, Glenda, super concerning, right? That all pregnant women really need to be vigilant and follow pandemic precautions. And here's the reason why. This study actually followed 240 pregnant women in Washington State. So right here in the U.S. And when the researchers, crunched the data, they found a 70% higher infection rate in pregnant women compared to non-pregnant women. That's a big number. And then the same age group. Now, also, what's really surprising to me was the death rate. It was 13 times higher in the expected mothers group compared to the group of women who are not expecting. So pretty surprising and startling results.
All right. So, Doc, what do we know about the women that passed away? Did they have underlying health conditions?
So that's an important question, Linda. So yes, they did. The researchers found that the hospitalized pregnant patients were more likely to have underlying conditions or comorbidities, as they're called, and they had two or more medical conditions. Now, the conditions that were listed included high blood pressure, obesity, type 2 diabetes, asthma, and autoimmune disease. And also concerning is that this study found that pregnant women who died were women from communities of color, and that pregnant women from minority ethnic groups had 2 to 4 times higher rates for COVID-19.
So the idea that pregnant women are protected from COVID-19 is really just a myth. Based on this study, are we saying that women, pregnant women in particular, and women of color, should they get vaccinated for COVID-19?
And so here's the thing, Glenda, folks should really be sure they get their information from a trustworthy site. Lots of folks are having lots of opinions and information out there. So, but to your question, right now there's limited data because earlier studies didn't specifically look at pregnant women. The good news so far is that there are no red flags. But I really expect, Glenda, that we'll know more in the near future because Pfizer just kicked off its clinical trial and they plan to enroll 4,000 pregnant women. In the meantime, the World Health Organization, right, has said that only pregnant women who are at a high risk of getting infected should get vaccinated. So I would right now personally recommend that expectant moms with this information first talk to their doctor to review the risks and benefits of getting vaccinated because the picture is not clear, but clearly some concerning information about pregnant women, at least in the U.S.
Figuring this out piece by piece, Doc. It's been tough.
Absolutely.
All right. Thank you so much for joining us this afternoon.
My pleasure. Thank you.
And if you have a coronavirus question for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter, and we'll get it right to him.